Welcome, I'm Steve Adubato. We're honored right out of the box to be joined by Dr. Adam Jarrett, Chief Medical Officer and Executive Vice President of Medical Affairs, Holy Name Medical Center. Good to see you, Dr. Jarrett.
Thank you, Steve. Good to see you.
By the way, you can check out Dr. Jarrett on NJ Spotlight News on a regular basis. He's been giving updates as to where things are. We're taping on the 17th of November. This will be seen after. So put things in perspective for us. Let's assume this is seen in January. You cannot predict the future. But the vaccine issue, as we speak right now, game changer?
Well, I think there's reasons to be cautiously optimistic, but I do think we need to be cautious about it. The results from the 2 vaccine studies are still preliminary. They're encouraging, and until they're final, I don't think we can count on them too much, but it is encouraging. But I do think the bigger issue is going to be getting those vaccines distributed. So it's going to be a challenge to get them out just to healthcare workers. The hope is that that can be done by early next year, and then getting them out to the general public will likely take even longer. And so I think that we're still talking about getting people vaccinated well into next year. And we just don't yet know whether the vaccine is going to work. The evidence is strongly suggestive that it is. The evidence is strongly suggestive that it's safe. I'll feel better when those studies are finalized, and I'll feel better once we know we have a distribution method for the vaccines.
Dr. Jarrett, you've been with us many times, and one of the things I realized I've never asked you that I need to ask you now is this. On a human level, how would you describe what the physicians, the nurses, the respiratory therapists, the frontline healthcare workers are facing on a daily basis?
So if you go back to March and April, this was a tremendous challenge. Like really
March and April 2020, this will be seen early in 2021, so go ahead.
So going back to March and April of this year, 2020, it was nothing like I've ever seen. I've been in healthcare for over 30 years. I trained in the middle of the AIDS pandemic, but this was like nothing I ever saw. And what my staff and the staff at Holy Name and really around the country had to go through was absolutely devastating. The volume of patients, the rapidity that patients were coming into the hospital, how sick patients were, the fact that patients were relatively young, the fact that patients were not able to have contact with family, just the sheer stress of having to take care of that population and then be worried about yourself and potentially taking home this virus to your family, especially when we knew very little about the virus. It was really a very difficult time, although I was very impressed with how the Holy Name staff handled it. I think what we're feeling now in November, as the volume begins to increase again, is fear. Are we going to get back to where we were back in earlier in 2020? And I think there's that apprehension. The hospital is situated much better. We have our COVID dedicated negative pressure units. We have our PPE. We do have a handful of therapeutics that are somewhat beneficial, but not so beneficial that we're still not seeing significant problems. So there's some hope and there's less panic, but there is still real fear that we're going to get back to where we were earlier the year when we had almost 250 patients here and over 45 patients on ventilators. And we had over 250 patients die just here alone at Holy Name.
You know, again, the unpredictability of all this, taping when we're taping, my question is this. You mentioned therapeutics. What appears to be, and I'm going to double, I usually don't ask two questions in one, but I'm going to do this. What appears to be most effective in treating COVID, A, and B, does it largely depend upon the patient and his or her condition?
So the most effective thing is to not get it. I know you weren't asking that question, but masks, probably more important than a vaccine. But once you have the disease, we have 2 proven treatments now, remdesivir and dexamethasone. They're not magic bullets, though. We do think they have a small benefit. We do think they get people out of the hospital sooner, and in a very small percentage of people, they likely prevent them from getting critically ill. But we know now that despite remdesivir and dexamethasone, we are still seeing a significant number of patients get critically ill. The potential for the monoclonal antibodies, I think, is going to be bigger than the remdesivir and the dexamethasone. Those drugs are now becoming more available. We are giving them here based on a study where 2 out of 3 people who qualify for the study are able to get the drug, and the other 1 out of 3 gets a placebo. And that drug is going to be very available, likely in the next week or so, based on emergency access through the FDA. And I am, again, cautiously optimistic because we still don't have definitive studies that those medicines could potentially be a significant breakthrough, but we're just not there yet.
We're speaking with Dr. Adam Jarrett, who's been on the front lines of this COVID fight from day one. Dr. Jarrett, let's try a public policy question. New president, Joe Biden, again, this will be seen in 2021. Say his administration is committed to public health, committed to following, quote, the science, and listening to public health and scientists, public health experts and scientists. What would the federal government, what should the federal government response to COVID look like? And how is that different from what we've had for the last year?
I think we need to be more open with the American people and talk about prevention. So masks and social distancing. I don't think we're at the point where we need to be talking about a national across the board lockdown, but I do think we need to be open to the fact that there's going to need to be strategic pulling back from opening. So depending on where you live, depending on the case rate there, we need to be more open to a 2 to 3 week or a 4 week pause. And then we need to open again and watch the case number. We need to accept the fact that until we have knocked out this pandemic, and that's different from knocking out the disease. We're going to be living with COVID-19 for years, but until we're not at the point where it's no longer a pandemic, we need to socially distance, wear masks, and be open to the fact that there are going to be times where society is going to have to shut down for short periods of time.
But hold on, Dr. Jarrett, you said living with COVID for years. If the vaccine or the vaccines plural prove effective into 2021, right? How could we be living with COVID for years?
Well, there's a difference between living with it as a pandemic and living with it as another disease that we just fight on a regular basis. So I am cautiously optimistic that by the end of 2021 and definitely into early 2022, we will no longer be in this pandemic state. But I also know that I will still, as a physician, be taking care of patients who have COVID-19. We're not going to eradicate this disease. We're going to get it to a point where we're not worried about it turning into a pandemic. But we still will see patients who come in with COVID-19, and we still will need to test for it, and we still will see some patients who get critically ill for several reasons. One, unfortunately, there'll be people who won't take the vaccine. Two, the vaccine will likely not be 100% effective. And three, we still don't know for sure how long the vaccine will be effective. So we have not eradicated polio as a world. We've gotten rid of it in this country, but we have not eradicated it. We have certainly not eradicated measles. So these diseases are still with us, and the healthcare community needs to be ready to deal with them. But that is different than saying we're going to be in this pandemic state, which I believe we should be out of by the end of 2021.
I've been listening to and watching Dr. Adam Jarrett, Chief Medical Officer, Executive Vice President, Medical Affairs, Holy Name Medical Center, to fully disclose one of the hospital systems that supports our public policy programming, particularly around healthcare. Dr. Jarrett, I want to thank you so much for joining us.
Steve, it's been a pleasure. Stay well.
Same to you. We'll be right back right after this.
State of Affairs with Steve Adubato is a production of the CAUCUS Educational Corporation. Funding has been provided by the Robert Wood Johnson Foundation, the Northward Center, MD Advantage Insurance Company, the Russell Berrie Foundation, Johnson & Johnson, Valley Bank, ADP, Fedway Associates, Inc., and by the Adler Aphasia Center. Promotional support provided by Jaffe Communications and by CIANJ and Commerce Magazine.
Choosing a new family doctor can be confusing. Check with your health insurer to see which physicians near you participate with your plan. Find out which hospitals the doctor uses and who covers when the doctor is away. And remember to schedule an appointment with your new doctor in advance to fill out any paperwork without the added stress of being sick.